My name is Dr. Stacey Gallacher, and I am a fellowship-trained orthopedic surgeon who specializes in shoulder and elbow surgery, and I'm here today with a patient to discuss their shoulder problems and do an exam. Tell me about your shoulder pain.
So I've had sharp pain probably the past 20 years, mostly just from surfing, lacrosse, and just different types of sports that has kind of limited me when it comes to training or just in general, just any type of use. Like right now, today's good, but past few weeks, it could sometimes just flare up and not really sure what's going on.
Okay. Well, first we'll start with inspection. There's a lot of things we can determine about the shoulder based on looking at the shoulder. We look at the symmetry of the shoulder to the other side, look at the muscles, and we also look at posture because all of those things will give us a lot of information about what's going on with the shoulder. After inspection, we'll move into palpation, which is where I'll touch various areas of the shoulder to look for any areas of pain or tenderness. We check the AC joint, the back of the shoulder joint, the region of the rotator cuff tendon, and the front of the shoulder where the biceps tendon lives. After palpation, we'll check the range of motion or the flexibility of the shoulder, and I like to compare it side to side to look for any differences between the bad shoulder and the good shoulder. So first I'll have you raise your arms all the way up and bring them back down and rotate out to the side and then reaching behind the back. After we check the range of motion, we'll then move into checking the strength, and we check the various muscle groups around the shoulder, including the deltoid, the biceps, and all of the individual rotator cuff muscles. So I'll have you hold your arms straight out in front, and I'm going to push down and you'll resist me as best as you can. Good. And we check individual rotator cuff muscles. Same thing. You'll bring your arms down to your side. I'll push in, you'll resist. Good. And you'll bring your hands to your stomach, and I'll pull. Good. Then arms up to the side like a goalpost. Don't let me push, and don't let me pull.
I'm gonna pull.
Good. After we check the general range of motion and strength, we can go into specialty testing to test various structures around the shoulder based on the patient's specific complaints. Patients who have a history of a dislocation, we can look for any laxity or loosening of the shoulder joint. An apprehension test can test whether or not there is pain or injury to a labrum after a dislocation. We also check the biceps tendon and where it originates at the top of the shoulder, at the labrum. Turn your palm up and hold it there. And pain in one direction but no pain in the other will often indicate problems with the biceps tendon and the superior labrum.